Marshall Linehan talks about the importance of trying to extinguish maladaptive coping behaviors, cutting behaviors, sublethal attempts, verbalizations of being suicidal. But when you systematically try to eliminate those or extinguish those through behavior therapy, say, then you are offering lots of other skills and training and reinforcing and training and reinforcing. And I interviewed a student once who worked on a DBT unit, a dialectic behavior therapy unit, who observed that DBT was very effective in reducing all these problematic behaviors. And she turned to me and she said, but they still feel really suicidal. They think about suicide all the time. They really want to kill themselves. What do you do about that? I said, gee, I don't know. So next time I saw Marcia, I said, Marcia, I told her the story. I said, what do you do about that? Thinking I could stump her. And she said, oh, that's easy. You start with the behaviors. You eliminate the cutting and the verbal threats and these overt actions that they've learned over a lifetime, developmentally, which have been reinforced over a lifetime. And those are a series of little battles. But if you're going to win the war with suicide, at the end of the day, you're going to make their life worth living, or be a part of a process that makes their life worth living. And so I love that. And I think she's absolutely right, as she is about so many things, that you sort of have many little mini wars along the way. But if this young woman's going to make it, it's because there's been a series of interventions that have convinced her or given her a fighting chance to battle for her life. But if she's really going to make it, it's because in some very fundamental way, she's going to feel like it is worth trying to live. And really, Lisa, what we know from our research is it's so simple. It's not really about psychopathology, at least with the suicidal people that we study. I mean, that's there for sure. Most of our patients have mental disorders. But when we ask them, and we actually do research about suicidal ideation, so people talk about suicidal ideation as if we know what it is. But we actually study the content of the suicidal thoughts. And what people are thinking about are relationships, work. And mind you, Freud said the key to happiness was work and love. So well over half of our responses are work-love responses. Issues of self, so Maslow, Jung, Kohut, lots of people talking about the self, right? And then having a way to deal with pain and suffering. So, that makes perfect sense. If you hate your relational world is miserable, and you hate yourself, and you hate what you do, and you don't know how to cope, who wouldn't want to kill themselves? And so, in her case, I would sort of, if I was in treatment with her, I would systematically try to address those kinds of issues, because we know that's what suicidal people don't have. We also know those of us who consider ourselves happy or sort of making it in the world are rich with relationships, with a meaningful career, with a sense of self. And then the punchline to this particular line of research is, when we look at reasons for living among suicidal people and reasons for living among non-suicidal people, it's very interesting, because the non-suicidal people have twice as much plans and goals and hopes for the future. It's much more aspirational. The suicidal people, their reasons for living tend to be more relationally focused, more sense of interpersonal obligation or loyalty as a reason for living. But if you don't have those things, or those things are you've never had those things, then you're not really engaged in what makes the world go round. And so it's interesting. We've been in this field for a long time, and we've studied why people want to kill themselves. But really, when you sort of invert all the work that we do, you're learning about the meaning of life. Mm-hmm. You're learning about what makes life worth living. You're learning about what really gives us a sense of purpose and peace and comfort and fulfillment in the world. The beauty of that model is not guaranteeing that you won't be suicidal again. What they're saying is the obvious. Of course you'll probably be suicidal again. How would you spend a lifetime, in a lot of these cases, having had this on your mind and then suddenly have it exorcised out of you forever? The difference is that when you sort of recognize it and what it is and what it isn't, and that you've got legitimate needs and a need to problem solve differently, and you've been trained how to do that, then maybe you can do it differently this time, and their data shows people can.